a cup of coffee, sit back and listen to Change Your Attitude, Change Your Life. Change Your Attitude, Change Your Life features stories to inspire and motivate you. Live your best life now. Listen, learn, think, and decide. Change your attitude, change your life. Visit cyacyl.com.
Welcome to Change Your Attitude, Change Your Life. I'm Joan Herman. Thanks for tuning in. Cancer is a major public health problem in the United States and many other parts of the world. Millions of people are living with cancer or have had cancer. According to the American Cancer Society, a total of 1,638,910 new cancer cases are projected to occur in the United States in 2012. Today, a cancer diagnosis is no longer a death sentence, as over past years, cancer deaths have declined. People are surviving cancer. So now what? Today's guest, Dr. Stewart Fleishman, is here to provide some answers. Dr. Fleishman is the author of Learn to Live Through Cancer, What You Need to Know and Do. This book is the result of Dr. Fleishman's 3 decades of research, patient outreach, and the development of his model of supportive integrative cancer treatment. He offers a roadmap to a healthier and meaningful future following a cancer diagnosis, and he explains how to improve the length and quality of life for cancer survivors, helping them to manage the variety of physical, emotional, and spiritual issues they face. Dr. Fleishman's extensive array of cancer-related questions and answers are now featured on Dr. Oz's Shareware website. Welcome, Dr. Fleishman. Thanks for joining us today.
Good morning. Thanks for having me.
Dr. Fleishman, in the introduction, I stated the statistic from the American Cancer Society that 1,638,910 new cancer cases will occur in the United States this year. I've also stated that cancer deaths have declined. Are these number of new cases on the rise? Is that 1,600,000 and some odd thousand? Is that a number that's steadily increasing?
Well, that number is increasing because the public health message that the field has been pushing for many years is effective. People are getting screened earlier. They're getting diagnosed earlier. More and more people are going for treatment because in many cancers, not all, unfortunately, but in many cancers, treatment is more effective. And the numbers show that there are about 12 million cancer survivors currently in the United States today, and it's projected that by the year 2022, that number will reach 22 million Americans.
So early detection, going for those physical checkups, that is really the key. Is that why, although the numbers is on the rise, people are not dying because we're catching it earlier? Is that the key to survival?
Well, it's a combination of things. It's going for the checkups as well as getting the screening tests that are very controversial, whether it's mammograms or PSAs for men with prostate cancer. The age to start, the age to stop, the interval between them is controversial, but those tests save lives.
Dr. Fleishman, is it becoming somewhat of a chronic condition? I mean, just something we're learning to live with? In some cases, not all cancers, but in some of them.
Well, that's true for many cancers, that people live a very long time and will often die of, unfortunately, something else not related to the cancer or their treatment.
So, Dr. Fleishman, for someone like me that has a genetic predisposition, my father and sister died of lung cancer, my brother died of leukemia, so genetically speaking, my risks are somewhat increased. So for someone like me that has a genetic predisposition, what should we be doing to try to increase the chance that we will not receive a cancer diagnosis one day?
Well, that's a good question. The pattern in lung cancer is now only being shown that it's not as clear-cut as the pattern, let's say, in breast cancer or ovarian cancer. So in lung cancer, with a history like that in the family, you and a primary care provider should really spend some time figuring out what type of vigilance you need. Some people would say that one of those new ultra-fast spiral CAT scans is the way to go, because that would find something, if it's growing at a very small size, that can be cured. But because you're going for many tests that actually may turn out luckily negative and exposing yourself to additional radiation exposure, that's still a question, and that needs to be assessed individually by an individual patient with an individual doctor until the guidelines are clear. If you smoked, if you've been exposed to lots of secondhand smoke or other pollutants or chemicals that may also promote lung cancer, then that feeds into the puzzle. It's an individual decision at this point.
So someone with a genetic predisposition really has to follow the same type of protocol as anyone else, but we just need to be a little bit more diligent about it.
At least the same protocol and maybe more on a case-by-case basis.
Are any of the risks of cancer preventable, and what types of cancers are really, in your opinion, preventable today?
Well, the issue about tobacco products and smoking is rather clear, and those products actually can affect not only lung cancer, but head and neck cancers, cancers in the esophagus, cancers of the bladder. That's a real big one. There's more and more evidence as time goes by that being significantly overweight because of the risk of retaining more hormones can actually promote the diagnosis or the development of breast cancer or prostate cancer, which are hormonally dependent cancers. So being overweight, significantly, smoking, secondhand smoke, or toxic chemicals that are known to be connected to the development of cancer are two of the big public health issues that can actually make a difference in the amount of cancer we're seeing in future generations.
Doctor, hearing those words, "you have cancer," those are probably some of the scariest words that most of us fear that one day we will hear. What is something that someone needs to do, the first thing that someone needs to do when they hear those words, "you have cancer"?
Well, hopefully, when you're hearing those words, hopefully no one should hear them at all.
Mm-hmm.
But if one does hear those words, you shouldn't be alone. You should be with someone. You should be with someone who you trust to ask a whole lot of questions and take a lot of good notes. Because once those words are uttered, study after study shows that even the brightest, most intelligent, most tuned-in people remember very little of what's said next. So having somebody there to listen and ask questions is a good idea. The next thing to do is to take a deep breath and to really learn about the situation. Because although it seems like you need to do something yesterday or even sooner, most people and most situations in which cancer is diagnosed, there's a little bit of time. And during that time, getting a second opinion, unless it's an emergency, is vital. That second opinion is almost always paid for by insurance plans, or you can negotiate that. And that second opinion will make sure that you and your family know that you're on the right track for you and your situation and your type of cancer.
Doctor, I'm a firm believer in patient advocacy, and I've done it for my family members. I mean, when my dad was battling lung cancer, I would go in with him to the oncologist with my list of questions from my research. And it actually got to the point where the doctor would jokingly say, "Okay, give me the list, Joan, and we'll go through them one by one." But what is your opinion? How important is it for a patient to question?
Well, the face of cancer treatment has changed. Now that it's gotten a lot more complicated, it's also becoming much more multidisciplinary. And the doctor is not the only one to answer all those questions. Now we have oncology nurses, oncology social workers, nutritionists, physical therapists, chaplains, all who specialize in supporting patients through cancer. So sometimes those questions are best directed to them. The other thing we have is the Internet, which is a huge amount of information flooding in, some good, some bad. Some does not apply to every individual. And some of the information is really bent towards selling a product, often a product that is considered complementary or alternative, which makes it more attractive to people. So there's a lot of information coming in, but it doesn't necessarily need to come from the doctor. But your dad was lucky in that he had an advocate who was trained sitting right there. Not every patient has that.
What would you say are some questions that a patient should always ask in the beginning?
Well, at the beginning is, what kind of cancer is it? If enough testing has been done, what stage is it? Where has it gone? And what is the best treatment plan with the information that we have now? Sometimes more tests need to be done, and sometimes the treatment plan isn't evident right at the beginning. The state of the art of cancer care at this point is not to get that answer immediately, as frustrating as that sounds, because there are almost all cancers require a multidisciplinary input between a surgical oncologist, a medical oncologist, that can offer chemotherapy and a radiation oncologist that can offer radiation. It is extremely rare to have all of those people, especially the senior experienced people, right in the room just at the time that you're getting this information. So large cancer centers and those that are accredited can give you a provisional amount of information on that first visit, but really should take the time to have the three disciplines meet with all the other people involved in cancer treatment, go over the imaging, look at the pathology slides, go over the clinical trials that are available, go over the standard of care that's public information for that an individual's type of cancer and stage of cancer, and then get back to the patient and family and prevent a consensus. Sometimes the people agree to disagree, but in general, most people agree. And this, fortunately, happens in centers that are accredited to be full-service cancer centers across the country, and that covers more than 70% of Americans.
You've been talking about a multidisciplinary team, and how important is it for us to treat the whole person, not just the physical, but the emotional and spiritual parts?
Well, I'm biased when it comes to this issue because I believe that cancer doesn't happen in a vacuum. It affects oneself to the core. It affects the way you live your life. It affects the choices you make at that moment. It affects your family. It affects your work. It affects all the things that you do that are important for sustenance and for fun and for existential and spiritual issues. So the multidisciplinary team can actually help cover all the bases because individual oncologists, as good or as smart or as wonderful as they can be, and there are many out there, can't do it all. And they require the touch and the wisdom and the time of all the other people.
Dr. Fleishman, we need to take a break. When we return, we will continue our conversation with Dr. Stewart Fleishman. This is Change Your Attitude, Change Your Life. Stay with us. We'll be right back. Change Your Attitude, Change Your Life now has a free monthly digital magazine that can be read online or emailed to your inbox. Each month, nationally recognized leaders in their field provide the information that you need to inspire and motivate you. We believe in a holistic approach to life, incorporating mind, body, and spirit. As philosopher Francis Bacon said, knowledge is power. Use the wisdom provided in the publication and apply it to your everyday life. Visit cyacyl.com for more information or to begin your free subscription. That's cyacyl.com. Welcome back to Change Your Attitude, Change Your Life. I'm Joan Herman, and our guest today is Dr. Stewart Fleishman, author of the book, Learn to Live Through Cancer, What You Need to Know and Do. Dr. Fleishman, before break, we were talking about the importance of a multidisciplinary team in attacking cancer. And as part of that team, what is your philosophy on the role of proper nutrition? How important is it in the prevention and then when you're going through treatment to eat properly and nourish your body?
Well, those are two very different issues that are often confused. Nutrition is an important role in our good health in general for healthy Americans, for all of us to prevent heart disease and to maintain heart disease from getting worse, as well as cancer. There are a number of foods that are considered anti-carcinogenic, anti-inflammatory, that in theory can prevent cancer. It shouldn't be so controversial because those are the things we should be eating anyway for all the other reasons, to remain healthy, to live a long life. So the kinds of foods that are thought to be preventive are the same high-quality foods, high-quality grains, fruits, vegetables of many colors, not necessarily supplements, but the fruits and vegetables themselves, and protein from non-animal sources. These are the guidelines that really overlap between guidelines for healthy Americans, guidelines for heart health, as well as guidelines for cancer prevention.
And then what about when you're going through treatment or after you've completed treatment? Same type of diet?
Well, it depends because there are some people who are not able to eat much. Let's say if you have a head and neck cancer or cancer in the esophagus where you can't swallow, or lung cancer when you're getting radiation and your esophagus has a candida infection. Many patients will have a feeding tube. It needs to be on a case-by-case basis, but good nutrition is vital despite whatever route the nutrition goes in. It's important to maintain one's lean body mass. In fact, Some of us had very smart grandmothers that said people don't die of cancer, they die of something else. And that something else is almost always directly related to poor nutrition. Not because people don't want to, it's because they can't. The other thing that's important to remember is that for many cancers, let's say lung cancer, that's already spread to the bone. Our body uses thousands of calories a day, maybe 6,000, 7,000 calories a day. We all know what it's like to be on a diet and to eat 1,500 or 2,000 calories. If you imagine what it's like eating 6,000 calories a day, that's a lot of work, even if it's really high-quality food. And the body is in overdrive, and it's very hard to maintain the body unless the proper caloric and the good calories are going in. So getting the proper nutrition, either by mouth or through tube or any other way, is really important during treatment. And there are also some things that help the body retain the calories you're eating so that you get the most benefit from them.
Are there some things that people can do during cancer treatment to make recovery easier? I mean, perhaps something like massage therapy, yoga, meditation, acupuncture, anything along those lines?
Well, those are really important because they help the body relax, and having restorative relaxation and sleep is one of the cornerstones of recovery from cancer. People sometimes get those modalities mixed up with the idea that they may be able to prevent cancer, and that's really never been shown scientifically. It's attractive, but it's never been shown scientifically. My approach is to take a very standard one. I got through medical school on mnemonics, so I've developed a system called the LEARN system, where very quickly you can get to all these factors in a few minutes every week and plan how you're going to spend your week. It's very easy to do, and that includes modalities for rest as well as good nutrition.
Doctor, does overeating sugar and bad carbs, does that have any impact on cancer?
That's a really good question. A lot of people think it can, and it actually may. There are people who refuse to eat during their treatment because they've read online that sugar feeds cancer, so they figure if they stop sugar, their cancer won't grow. But that can cause huge problems in blood clots and resistance to infection, major problems. But sugar itself, and the especially processed sugars, may actually affect the way that our body produces insulin and how quickly our blood sugars rise and fall. And many progressive thinkers think that is one of the things that actually can cause cancer to grow.
So it goes back to what I've heard so many doctors say. If it grows on a plant, eat it. If it's made in a plant, avoid it. Do you believe that to be true?
Well, that's a big generalization. Sometimes a little animal protein is really helpful, but it needs to be low fat and done in the proper way at the proper time. But in general, your saying is valid.
What about vaccinations for cancer patients?
Well, there are no accepted ones right now. There are many in clinical trials for many types of cancer. There is some discussion that they're effective, but there have not been in clinical trials long enough to be able to know if any of them really are effective. So those are strictly for clinical trials at this point.
So, doctor, someone's gone through the diagnosis, the treatment, and now there are no visible signs of cancer in this patient's body. What is the person's plan now for the rest of his or her life?
Well, the plan is really to recover from their cancer and to be able to live with the idea that a recurrence or a relapse may happen and be able to put that in its own place psychologically, as well as do all the practical day-to-day things to recover. It affects everything. When you go back to work, when you go back to school, who you tell, can you travel, where can you go, the doctors you should be seeing in the future, the plans you make for the future. It really affects your whole life. So the idea is to actually take all those things into account, and I'm very biased in thinking that the time to work on that is not at the end of treatment, but from the very day of diagnosis.
Doctor, what about the role of spirituality? In your research, have you seen a correlation between healing with patients that are more spiritual than those that are not?
Well, that's also somewhat controversial because in American medicine we used to put spirituality on the side, thinking that was too personal and that's something that didn't belong in medicine. We now understand that to heal the body, our minds and our spirits need to be in the best place possible. So spirituality certainly has more and more of a role in hospitals and in treatment for illnesses, especially cancer treatment. The people who come in accredited hospitals and cancer centers that are separate agencies now look for the involvement of spiritual counseling in their programs. It's thought to be really, really important in the healing process. However, there are some people who believe that spirituality alone can heal cancer, and that's extremely controversial and not based in the science as we know it today.
The book is Learn to Live Through Cancer, What You Need to Know and Do by Dr. Stewart Fleishman. Dr. Fleishman, if our listeners would like to get more information about you, where can they go?
Well, online, the website is www.cancerknowando, CancerKnowandO.com, and on Facebook at Cancer Know and Do.
So cancerknowando.com, or as always, our listeners can visit our website, cyacyl.com. That stands for Change Your Attitude, Change Your Life. While on our site, listen to past shows as podcasts, read the digital magazine, sign up for our mailing list, take part in our book club, and be sure to follow the show on Facebook and Twitter. Dr. Fleishman, before we run out of time, what are a couple of things that you would like our listeners to remember from this interview, the most important things?
Well, the most important things are have a plan. It takes a village, and you often need somebody with you at the beginning. And then I really do encourage people to work on getting better right from the time of diagnosis, so they're not so spent at the end, they're not so fatigued, they haven't gained or lost too much weight, and they're not so frightened. You can spend your time controlling the things that you can control. Since you can't control the cancer and you can't control the treatment, you can control on how much you're exercising, what you're eating, what you're doing, and what you're learning in order to come out as whole as possible.
Doctor, thank you so much for spending time with us today. As I said, cancer is a major public health concern, and it's something that's very scary to all of us. And I think the information that you've provided here today will help to empower so many people. So thanks for stopping by.
Thanks for having me.
This is Change Your Attitude, Change Your Life. I'm Joan Herman. Thanks for tuning in.